Distinguished members of the European Parliament, esteemed colleagues, and fellow leaders in chiropractic, I'm humbled and honored to be here in my capacity as a chiropractor and as the president of the Netherlands Chiropractic Association. My name is Gitte, and I'll be presenting to you an example of how one small chiropractic association is trying to get these messages across to the public. Normally, a speaker gives praise to her mentors by saying something along the lines of, "I'm able to see further because I'm standing on the shoulders of giants." In my case, the giants of my profession is right here in the room with us today, and I applaud and appreciate all you do. It's a privilege to be in your company. You'll recognize this slide from the previous presentation. There are gaps everywhere. There are gaps between scientists and clinicians, between science and public health, between lawmakers, regulators, clinicians and their patients. This is not new or particular to our profession. But what we as a chiropractic association wanted to do was to close the gap between what we as chiropractors know that we do and what the public doesn't yet fully know that we do. They typically don't know where to place us in the plethora of the professions that are in the musculoskeletal field, and I'll get back to that towards the end. So before you can present yourself accurately to the outside world, you need internal consensus. So we initiated a lengthy process with healthy discussion and necessary debate, and this is what we concluded. Who we are, and all of you. So who we are is spinal healthcare experts. We're academically trained. I'm still reading from my slide. Sorry. We envision evidence-based practice. We have high standards with post-grad education. We diagnose, we treat, and advise, and you'll recognize those three words later on. We cooperate with others in healthcare, and we expect patients to be active in their healing process. And what we stand for is boiled down to 4 key ingredients. Quality, we are academically trained professionals. Expertise, in the conservative management of neck and low back pain. Integrity, patients come first. And sustainability, we deliver safe, affordable, accessible, low-tech healthcare. Right, so know thyself, and now onwards to the public. The public, it's a beautiful concept. Who are they? They're we, they're all of us. It's our families and our friends, which makes it a tough target audience, much like here today. And before you can go anywhere in the world, you need data to use in our planned press releases and for social media. So we did 2 surveys. One public survey was handled by a professional agency using telephone interviews, age and gender matched to the background population. And one thing really stood out to me, that 23% of adult Dutch people have been to a chiropractor or are currently undergoing chiropractic care. For us, this is huge for an unregulated, unprotected profession in the Netherlands. I'm sure other professions enjoy the reverse percentage. We conducted a benchmark survey amongst our members, showed that in comparison with previous years that we're close to maximum capacity in our practices. Many practices have waiting lists, and they're growing. Some even have patient stops for new patients. 10% of practices are looking for additional chiropractors. We can't handle public demand. And that all formed the basis of the first press release that we sent out. We were on the morning radio news, and that evening we were the opening item of a national light news TV program. We didn't pay for it, we didn't plan for it, but we did do our homework first. Beforehand, we'd visited editorial offices of print and online broadcast media and explained about chiropractic and warned them about our upcoming press release so that we could fit that in with their agenda. The press release was picked up by print media, online media, and here's a picture of my radio interview where gestures are pointless. So our main points in the press release was that chiropractics exist. We do spine. We like to keep it simple. And even though about a quarter of the Dutch know us, we're at full capacity. So the main point was we need more homegrown chiropractors. We don't have an education in Holland. Alongside the official press releases, we've designed a few recurring items for our social media pages, open and closed, and the NCA presents noteworthy and newsworthy members that are doing extraordinary things. Here's my colleague and PhD student at the Free University in Amsterdam, Annemarie de Soete. She's receiving a research award from the last ECU meeting. We have NCA members in the spotlight, where we have a professional photographer and a streamlined interview process to get them out to their social media accounts and our common social media account to allow a peek inside their offices. Famous Dutch people are also part of the public, so they get low back pain too. And we're interviewing them as they agree to be ambassadors for us. We have initiated a National Back Pain Day, November 3rd, called Dag tegen Rugpijn, which is a play on words in Dutch. It's goodbye back pain, and also the day of back pain, where many practices do public health tips, exercises, back screenings, games involving health, in an informal setting for the general public. Next, please. Which brings me to press release number 2. From a Dutch government bureau, we learned that the number of patients registered with a GP as having low back pain and neck pain has now increased again to surpass 2 million people. That is 1 in 8 Dutch, and these are the ones registered with a GP. We were the first group to pick up on this and raised the alert and pointed to possible causes. Without making it into something about us, it's about the patients. I was on live national radio in the morning, and they used that sound fragment all throughout the day on national TV. So once you set things in motion, you should expect a reaction similar to Newton's third law. And I think this is very representative, if you could read that from your seat. I have 2 tweets up there. The first tweet on the left says, "Why is a chiropractor even talking? They're alternative, there is no recognition of their education or profession, and there's no proof of efficacy." After my colleagues have spoken here today, I'm sure you have a different idea about that. The other tweet on the right says, "An orthopedic surgeon and a neurologist at the same hospital. One says, 'Don't go there,' and the other says, 'Go see one, they do great work.' That the Netherlands don't have a chiropractic program and other countries do says more about the Netherlands. Bizarre, the lack of recognition." Next, please. Which brings us to the conundrum where to place chiropractors. So going back to our critical healthcare consumer tweet on the left, you can't prove an entire profession, but you can break it down into small testable items. Do we diagnose? Yes. At which level, you may ask? MD level, but targeted at musculoskeletal complaints. I personally enjoyed 3 years of medical school in Denmark before entering the 2-year master program in chiropractic. Other programs are designed differently, but all adhere to the same high standards. Treatment can be spinal manipulation, soft tissue work, mobilization, traction, and so forth. As for proof of efficacy, you've just heard Professor Hartwig talk about this, but it has again been found to be as effective as targeted exercises, and this will be published in the British Medical Journal end of this month as a Cochrane review. Advice, what is being said to the patients, keep moving, don't be afraid to move. Here are some targeted exercises, stay active. We offer reassurance, comfort, and collaborate with personal trainers, physiotherapists whenever possible and necessary, and of course refer out as indicated. All quite in line with the Lancet recommendations. So I leave you with one message and one hope. The one message is we're looking to be a part of the team. We're not looking to replace anyone. We're looking to relieve the system. And I have one hope for chiropractors in Europe: to help keep Europeans healthy, active, pain-free, with low cost and effective healthcare. Thank you for your attention.